I can't miss World Menopause Day, which was this week. And it's so important to talk about menopause. And I'm so happy that women are getting more aware of their choices. Women are getting aware that they do not have to suffer because of the menopause. Some of the things that I'm looking forward to is that we start teaching about menopause in school. So when we're teaching about menarche, when girls are starting their periods, we should also teach them about menopause and when this will happen because it's a very big life change. Many women are suffering from the symptoms of menopause and it presents in so many ways and women suffer for years when there are easy answers. So if you are anywhere over 40, you can start to experience symptoms of what we call perimenopause as your body builds up to stopping menstruation, where your eggs will stop, you stop ovulating, you stop releasing eggs regularly. And that can last up until 55, 56, where the periods completely stop. So when the perimenopause starts, what happens is your periods become infrequent. So, or they might also become very frequent. So you might have, maybe you were having bleeding every month. You might now be having bleeding every 2 to 3 weeks, and it gets very heavy. For some women, it just becomes less frequent, where maybe they might not have a bleed for 3 months or 6 months. And this is very, it's just very eccentric and very sporadic, and it can go on for a while. Then subsequently what then happens is that the periods, the cycle lengthens out to a point where you have no period, and if you have not had a period for a year, then we'll now say this woman is menopausal. And what kind of symptoms can you expect? It affects everything. So the most common ones people talk about is hot flushes, really feeling hot, night sweats, have the cover off, cover on, cover off, cover on type situation. You see women talking to you and breaking out in sweat, irritable, angry, sad, maybe heart palpitations, mind fog, you're not remembering things, vaginal dryness, low sex drive, you're just not enjoying everything about your body that you previously enjoyed. These are all symptoms that can be easily tackled, And one of the big things I say about tackling these symptoms is to go natural first. And when I say natural, I'll say, eating well, lots of water, exercising, really doing all of that, maintaining a healthy weight, meditation, journaling, whatever you can do to keep yourself, centered. And then go and have your HRT. There are alternatives to HRT. HRT means hormone replacement therapy. There are alternatives to it, but to be honest with you, I don't know many that work really well. So we have hormone replacement therapy, and then we also have some non-hormonal medication that can help with your mood or with the hot flushes. So it's worth looking at things like some selective serotonin reuptake inhibitors, which are kind of antidepressants, but they help with the symptoms of menopause. But really, the gold standard is hormone replacement therapy, where you have, extra estrogen and progesterone. The estrogen can come in a cream or a tablet or a patch, and the progesterone can either come combined with the estrogen in a patch or in a tablet, or you take it on its own or have it as a coil, like the Mirena coil. Honestly, when I've seen women who have come almost fed up with life and the change that they have when they start HRT, it's like night and day. And it's particularly effective if you start the HRT before you by the time you turn 50. So some women will wait, and maybe their friends or their pastors or their imams or whoever tells them, oh, hormones are not good, and they wait till they're 55 before they start it. You don't have the same outcome. So we say that when you start it by the age of 50, it also gives you some sort of protection from heart disease. It does other things for you. So the earlier you start it, the better. So there are all sorts of hormone replacement therapy. In the UK, we give standard hormone replacement to everyone. There are other methods available where you can have, sort of personalized hormone replacement therapy, which is more available in America. But these things are there, and you can live your life to the fullest. You can have the best sex of your life after 50. You can have great skin, you can have great hair. You don't have to suffer. I mean, menopause affects everything. Even you find some people who have dry skin, they're itchy. Um, it's not necessary. It really isn't. I'm an advocate for hormone replacement therapy. I must say that obviously there are instances where we wouldn't give hormones. So it's important that you check with your doctor that you are suitable and you don't have any risk factors for things like clots or breast cancer. So it's important, but the guidelines are very different. So yes, if you do want to learn more, you can book a consultation with me. I am Dr. Simi. I have been a doctor for quite a long time. I mean, I don't look it, I'm sure, but I have been a doctor for quite a long time, and women's health is one of my interests. So you can have a consultation at the clinic or virtually, and we can discuss your own personal needs. Um, yeah, let's talk about it. And what have you done differently? How have you dealt with menopause if you're of that age? And there are also women who are younger who go into early menopause, women under 40 who stop their periods early. If you're in that demographic, how have you coped with it? It's a different challenge at that time. It's worth, discussing, making these things an open discussion. Women deserve to have a fantastic life. So let's talk about menopause openly. If you're a younger woman, think about it. Think about what you're going to do because time soon comes around. You're 18 today, but before you know what's happening, you're 50. So it's worth thinking about. So yeah, happy belated World Menopause Day, and you guys do have a most amazing week.